Hello everyone, welcome back to my channel. Today we are going to be talking about a particular topic which affects most women, and it is fibroids and myomectomy, which is the removal of fibroids. There are a lot of misconceptions, especially in Nigeria, about this particular topic, and today we are going to be setting the record straight. So before we begin, let's start by defining or knowing what fibroids are. Fibroids are benign growth, benign meaning they are not cancerous. They are growths that occurs anywhere in a woman's womb. Fibroids are also called myoma. The surgery used in removing fibroids is called myomectomy. The first myth I'll be talking about is that women with fibroids cannot have children, that women with fibroids cannot give birth. That is not true. Women with fibroid, a lot of women with fibroid are still giving birth, and they can give birth to as many children as they want. It all depends on the location of the fibroid that will determine whether it will affect fertility. So women with fibroid can still give birth. It's just certain kinds of fibroid or certain types of fibroid, and depends on the location of the fibroids that may affect fertility. And once she gets treatment for it, once she gets surgeries and treatments for it, she can get pregnant. And the second myth I'll be talking about is that people feel that fibroids cannot reoccur. That is not true. Fibroids, they do reoccur. Not for every woman though, but for some women, fibroids tend to reoccur, especially when the woman is still menstruating, because the hormone responsible that favors the growth of these fibroids are still present. So it tends to reoccur for some women. Then the third thing I want to talk about is that fibroids, some persons feel that fibroids, they are caused by spiritual attack, they are caused by evil spirits. That is not true. There are some hormones in women that favors the growth of these fibroids, which are estrogen and progesterone. The fourth myth or misconception is that all fibroids require surgery. That will not always be true. If a woman is not symptomatic, even while with fibroid, the woman is not symptomatic, the woman may not require surgery. She just needs to be monitored by the doctor. And when I mean symptomatic, I mean that, for instance, fibroids causes intense bleeding for most women. If the blood volume of this woman is still intact and is not affected, our other organs, because fibroids may grow as big as affecting our other organs. The other organs are still intact and the fibroid is not pressing or affecting our other organs or causing infertility for her, then there may be no need to perform this surgery for her. The fifth thing is that women that go through myomectomy, their uterus may be affected. That is not true. Fibroids can be removed even without their uterus or their womb being affected. So that is a myth that should be corrected. And the next thing is that I have heard about this one a lot, is that herbal mixtures can cure fibroid. That is not true. They are not scientifically tested or even proven. And taking it may cause damage to your liver and organs in your body. The next myth on my list is that women who go through myomectomy, they cannot get pregnant again. That is not true. It is even the removal, it is even the fibroid itself that causes infertility, and the removal of the fibroid helps to improve fertility. So it is not true saying that women who go through myomectomy, they tend not to get pregnant again. And lastly, some persons feel that fibroids turn into cancer. That is not true. Fibroids are benign growth. Benign meaning they are not cancerous. They don't turn into cancer. Thanks for watching, guys. If you found this video helpful, kindly give it a thumbs up. Subscribe to my channel for more health education videos, and share my videos with other moms to be, because knowledge is power and it may end up saving lives.